Hello and welcome to Danny Golden's podcast. Today, I'm very excited because we have Dr. Lily Parks Springer, a California licensed psychologist who specializes in the treatment of eating disorders in teens and young adults. So, we are going to dive into the world of eating disorders and utilize Dr. Springer's knowledge to basically educate us and let us know what an eating disorder is, what causes eating disorders, the truth behind common myths, the role of social media and diet culture in eating disorders in athletes, and eating disorder recovery. So, what treatment really looks like for an eating disorder. So, let's start with part one. Dr. Springer, please let us know what an eating disorder is and what they really look like. And then I have in my notes, it's not what you think. So I thought that's really interesting. So
Mhm.
please elaborate.
Yeah, absolutely. Well, before we get started today, everything that we talk about today, I just want to say I'm not, providing treatment in any way. I'm only offering my advice and feedback based on my own clinical experience and training. I've been in this field for quite a while at this point, and have finally ventured out on my own. I'm licensed now, so just really excited to be working in the outpatient world. So just excited to share my knowledge, share my experience. But eating disorders, there's a typical image that we see in media, and there's typical expectations of what we think an eating disorder is. But in general, an eating disorder is a disturbance of eating or eating related behaviors, and it results in altered consumption or absorption of food in some way. And whatever that is, whatever you're engaging in, it significantly impairs your life in some way. So I say that because that's a critical piece of the puzzle here. A lot of people might engage in disordered eating in some way or another, like the diet culture society that we live in. Not everybody is, always engaging in just regular eating patterns, but if it's interfering in your life in some way or another, like physically, mentally, emotionally, socially, that's when we know that there's probably a problem here that we're engaging in and we're experiencing.
Interesting. Okay. Yeah. So the distinction is that it's basically become so obvious of a distraction in your life that it really prevents you from living your life the way that you would had it if it wasn't there.
Yeah, it gets in the way in some way, and we often see it often gets in the way in social emotional aspects before we see the physical aspects, but the
Hmm.
physical aspects are when it really starts to get caught by other people. Eating disorders can be so secretive. It often flies under the radar, so until we see a doctor who realizes, hey, like your vitals are off, or we're seeing a really big shift in your weight here, that's often the first time it really gets caught and we start receiving treatment for it. So it really it's pervasive. It impacts a lot of different areas of the life.
Very interesting. Yeah, I
Mhm.
mean, growing up and just exploring, I remember trying to like eat less and not starve myself, but like eat less, and that didn't work. And then I did go through a period where, not a period, I would say I would binge, like in college, I would binge eat, and then I was like, oh, well, I know people throw up, and then I would try it, and I would be like, no, this isn't working for me. So it's
Mhm.
interesting. I kind of did explore what those things, like what I felt like some of my friends were doing at the time, because I was like,
Mhm.
well, I don't know, like you're learning about yourself at that age. You're very impressionable, and I just felt like and I had stopped swimming competitively, so my body had changed, and so there were just a lot of factors going on. So that's really interesting. But it monopolizes your thoughts when you're not happy with your weight, and then you
Mhm.
feel like you have this control
Yeah,
over it.
absolutely. Control is such a big piece of the puzzle there. I'm glad you bring that up because it's it's a way to often regain control and feel like you have a sense of agency when there are a lot of things that maybe feel like are outside of your control. So what you're explaining is what so many people experience. We're told by society that we need to look a certain way, that we need to
Hmm.
fit into a box and change ourselves in order to fit some unspoken norm that's ever changing. And sometimes we engage in these behaviors and it doesn't go any further than that. You try it and you're like, that's not for me. But
Mm-hmm.
sometimes folks do try it and they realize this actually makes me feel really good. This is
Mm-hmm.
something that gives me that sense of control. And a lot of factors come into play in the development of an eating disorder. And so if you have, that perfect storm of all these variables, it can kind of just, run away. You
Yeah.
might start with good intentions and it's like a ball rolling down the hill.
Yeah, I can definitely see how that can happen.
Mm-hmm.
Um, Anything else to add to part one about explaining an eating disorder? You definitely did a great job of explaining how does this differ from body dysmorphia?
Oh, yeah, that's a really great question. So, body dysmorphia is a little different. Body dysmorphia is actually under a category of obsessive compulsive and related disorders. So, it's
Oh,
about recurrent thoughts and repetitive behaviors as a response. So, there's a preoccupation with perceived defects and flaws in physical appearance, which is something that we do see in certain eating disorders like anorexia nervosa and bulimia nervosa. There's this over attribution of like importance of looking a certain way, shape and weight related. But body dysmorphia, it's not always shape and weight related. And so the response to the preoccupation with those perceived defects in body dysmorphia, it's not necessarily like I'm going to restrict my eating or like you get stuck in a binge purge behavior. The responses are often like checking things like checking your appearance in the mirror or excessive grooming, skin picking, reassurance seeking, things like that. So, body dysmorphia and an eating disorder can occur at the same time, but not always. They can often occur in isolation from one another.
interesting. Okay, thank you for
Mhm.
explaining that. It's very helpful.
Totally.
Um, and then I have in my notes, most people think they know what an eating disorder looks like, why most people are wrong, and we basically talked about that, right? Like that it's not like you all of a sudden see someone that you've been hanging out with or a friend and they've lost this dramatic amount of weight. It's
Mhm.
I've been around someone in the past where they carried a cooler with them with their food in it and things like that because they related that to their physicality and how they dieted and they wanted it to be like certain foods. Would that be a disorder eating if you're
I
doing
mean,
something like that?
it's tough to say because I wouldn't know if that behavior is necessarily impairing their life in any way. Because people
Hmm.
do certainly have like specific preferences,
Yeah.
and that's expected. That's totally normal. But you're right. It's not always like we see someone has lost a lot of weight. That's an eating disorder. We
Right.
see it in media. Often media portrays eating disorders as like a young, skinny white woman's disorder, and that's just not it. It's such a damaging narrative because eating disorders can be pretty competitive. Like if
Hmm.
you are shown this image of what an eating disorder looks like and you have an eating disorder, the eating disorder thoughts might say, well, I'm not sick enough because I don't look like that. And not all eating disorders are that competitive, but sometimes it can fuel other people's eating disorders when they see that.
Interesting. Wow.
Mm-hmm.
Okay.
Yeah. And eating disorders don't discriminate based on gender, race, ethnicity, age. It's across so many different demographics. So that image that we see it often also leads to medical providers not catching eating disorders in other populations because it can present differently. So it's not just someone's lost a lot of weight. There are other disorders that where people are at what's considered a normal weight range, or maybe they are just like fearful of eating food. It has nothing to do with shape or weight. So it's a really
Oh.
wide range of disorders.
Okay. Interesting. So they just
Mm-hmm.
might not like food, or they might be a really picky eater, or have some sort of
Mm-hmm.
relationship with food that's preventing them from consuming the necessary nutrients that they need to keep their body healthy.
Yeah, exactly. So that's you're touching on avoidant restrictive food intake disorder, and that's one of the
Okay.
disorders that I treat. I focus on anorexia, bulimia, and The shortened version is ARFID. So ARFID has three different subtypes. There's a lack of interest in food, and just like low hunger cues, you're just not interested in eating. There's an avoidance based on certain characteristics of the food, like maybe sensory characteristics. And then there's the concern of aversive consequences. So a lot of fear based, like if I eat this thing, this negative consequence could potentially happen. So whatever the reason is, they're avoiding food and it's causing typically a lot of like physical issues.
Well, yeah, because your body's not getting the nutrients it needs.
Mm-hmm. Yeah.
Interesting.